Hilary, you know, you still work as a GP, we know that. What is making GPs retire and causing this problem, essentially?
I think a number of things. Certainly, there's a crisis in funding. The BMA have been asking successive governments for more resources for many, many years.
There has been more money put in, though, hasn't there?
There has, but not enough. You've got a huge rise in expectation from patients, huge numbers, increase in patients. Most practices are seeing a 20% increase in their list of patients over the last 10 years, but that hasn't been matched by funding. It's difficult to recruit enough of the workforce, so you can't recruit new GPs. The government promised 5,000 more GPs. We lost 400 in the last year, so it's getting worse, not better. There's also the problem of the burden of reappraisal and constant inspection in general practice surgeries. Patient expectations are higher. They've just put up premises costs for maintenance and for rent, and GPs have just had enough. They just don't get any satisfaction out of the job anymore, and this is a very worrying sign because traditionally, since the inception of the NHS in 1948, GPs were the holding point for all patients. They stopped too many patients going to A&E and to hospitals, and now with the crisis in general practice, the A&E situation can only get worse.
The reality is, of course, Hilary, if you can't get an appointment with your GP, or you don't have a GP because your GP closes, just go to A&E. And then that, of course, puts a massive burden on A&E, and that's struggling too.
No, it's very easy to blame successive governments, and I do, but it's also, from my point of view as a GP, partly the responsibility of GPs. They elected some years ago to give up the most satisfying part of their work, the nights, the weekends, where they saw emergency work. They gave up doing minor operations. They gave up doing obstetrics. So now they sit in front of computers in their surgeries, seeing patient after patient after patient, and they're getting tired and exhausted. It's not as satisfying as it used to be.
Right, so the professional satisfaction
And from patients' point of view, they like to see the same doctor. They like to know who they were seeing. The doctor knew them. And the doctors weren't just their doctor, but they were their priest, their confessor, their counsellor, their friend, their social worker.
But things have changed, haven't they? No, it doesn't exist anymore. But why can't... I'm confused as to why we can't recruit. I mean, you know, medical schools are full of young, brilliant people in this country who...
Well, I said to Jeremy Hunt 4 years ago, you need to make sure that those doctors who you train at vast expense stay in the health service for at least 3 to 5 years. It's similar to what they do in the services, but that wasn't done. So we have a third of people qualifying who never practice medicine. That's absurd.
Yes,
we have a ratio of men to women. We need women doctors, but a lot of women go and have babies, go and have families, and never come back to the profession either. So we need to look at that. We need to look at the number of overseas doctors we're training who then go abroad and we never have the benefit of their services either. So there are many things that can be done, and by golly, it needs to be done very urgently.